Hello and welcome, everybody. My name is Amanda Schellinger, and I'm with the National Kidney Foundation of Wisconsin. Today's topic is eating for stage 3 CKD. Before we dive in, I have a couple of housekeeping announcements. This presentation is being recorded, and the recording will be made available on our website following this event. So look for that in the next few weeks. Please note all attendees have their mics muted and their cameras turned off. This is so that we avoid any disruptions to the presentation. However, if you have any questions, you can go ahead and click the Q&A tab at the top of your webinar screen and enter your question into the box on the right-hand side of your screen. All questions will be answered at the end of the presentation. Lastly, I'd just like to take a moment to share a little bit about NKF Wisconsin, as well as some upcoming events that we have. Who is NKF Wisconsin? The National Kidney Foundation of Wisconsin is a nonprofit organization dedicated to preventing kidney diseases, improving the health and well-being of individuals and families affected by kidney disease, and increasing the availability of all organs for transplantation. We do this through professional education, patient education, awareness and advocacy efforts, as well as through providing free services such as our kidney community screenings, as well as our medical ID jewelry program. Additionally, we have other NKFW upcoming events I'd like to call your attention to. For patients, we have 3 more upcoming webinars. In January, we will have a webinar on supporting transplant as a caregiver, strategies to avoid burnout and promote well-being. In February, on the 6th, we will have one on hypertension and kidney health, and then on April 17th, understanding living donation. So we hope you're able to join us for those. For anyone else, we have our Spotlight on Life Gala, which will be held on World Kidney Day, Thursday, March 14th, 2024, and that'll be at the Ingleside Hotel. And then for professionals, we have our Renal Professional Education Conference. We just had our 2023 one a few weeks ago, but 2024 will be another one in November, so keep your eyes peeled for more information on that. You can find out any information about these events on our website at kidneywi.org. And with that, I will turn it over to Jill Hoyt to go ahead and begin today's presentation. Thank you so much.
All right, thanks, Amanda. And I just want to thank the NKF of Wisconsin for inviting me to talk today. And thank you to all of you for signing up and joining in. And really, I think taking a priority in your health and your kidney disease, whether it's you yourself that has it, or maybe you're listening in today for a loved one that you know. A little bit about myself. I work at the Mayo Clinic Health System in Eau Claire, Wisconsin, and I have been in the renal field for a little over 18 years now. The majority of my years I have been working in dialysis until recently, where I've kind of been shifting my focus, working more with patients that are in CKD stages 3 and 4, even 5 that are pre-dialysis. And the reason I've been doing more of that is because the studies have really shown in recent years, like in the last 2, 3, 5 years, that have really supported that changes in your diet, not even huge changes, but changes in your diet can really make a difference in the managing of your kidney disease, delaying the progression of it, potentially keeping you off dialysis or delaying it long enough until you could get a transplant. So we really, want to shift our practice to prevention and keeping patients off dialysis. As far as disclosures, I have no financial disclosures today. My objectives. So today I'm going to talk or provide about a broad overview of the diet guidelines for CKD stage 3. And I just want to emphasize this is a broad overview. Keep in mind, all of you are unique individuals and need specific recommendations based on, your bodies, your labs, your other medical conditions that you may have. So I obviously don't know all of those today and can't get into all of those, but I will give you the general guidelines. And we often refer to it just as a plant-based diet, and you'll get more of a gist of what I mean by that in the next slides. And I want to let you know about the benefit of working with a renal dietitian. And actually, it doesn't have to be specifically a renal dietitian. There are dietitians that's where their expertise is. But if you don't have access to one within your health system, any dietitian should be able to help you quite well. And then I'll give you some resources to where you can find a renal dietitian if needed. All right, so the benefits of a plant-based diet. What can this do and what does it all mean? A plant-based diet, the studies have shown that it can improve your weight, your blood pressure, cholesterol, blood sugar control, your gut health, your overall nutrition status, and your potassium and phosphorus. And if we just think about plant-based, think about what plants are. Primarily your fruits and vegetables, your whole grains. Well, they're low in fat, low in sugar, so that obviously means lower calories. So that's where we can get the benefit of a better weight or improvement in your weight. Um, Low salt, so we have improvements in your blood pressure. Low fat, low sugar, like I said, so that's improvements to your cholesterol and your blood sugar. All that wonderful fiber that the whole grains and fruits and vegetables have contribute to a good gut health. A gut health is something that has been really studied most recently too, and they're finding that if you know the core of your body, your gut is healthy, the rest of you will be healthier too. And if it's not, then that's the stem of a lot of our medical conditions that we have this today. Nutrition status and improved nutrition status. Our fruits and vegetables are full of vitamins and minerals and antioxidants and that just can improve your overall nutrition status. And then your potassium and phosphorus. A lot of those foods are very high in potassium and phosphorus. And for years, we have been telling patients to inappropriately avoid those, limit or avoid those. And that's not the case of what they should be doing. Eating a plant-based diet, you see all the wonderful things it can do there is reduce or slow your CKD progression, reduce the proteinuria or the protein in your urine, which is part of your kidney disease, reduce inflammation in your body, which could be coming from your kidney disease or your heart disease and your diabetes, other medical conditions that you have. It can reduce metabolic acidosis, which is very important for the management of your kidney disease. Um, Plant-based overall is a lower, what we call acid load to your body, is what how it really improves your or manages your kidney disease is we're eating more plants and less animal products reduces the acid load. So that improves your metabolic acidosis. It reduces malnutrition. Again, back to that overall nutrition status. Lots of fruits and vegetables equals lots of vitamins and minerals. And then the overall reduces the risk of your mortality. All right, so now we're going to get into some specific actual um, minerals and such of what we talk about when we're talking about the renal diet or the CKD diet. I hope you've all learned at this stage, about sodium or salt. That is the first and foremost thing that we talk to patients about. And the reason is because it helps keep control or balance the fluids in your body. If you have too much fluid in your body, that puts pressure on your heart, that puts pressure on your kidneys and makes them work harder and can, further progression or further damage them, which is what we don't want. So limiting the salt in your diet can help manage and keep your kidneys at a healthier state. Um, if your kidneys aren't working as well, all that extra sodium fluid builds up in your body, and then you can get some of those symptoms on the screen there, your swollen ankles or the edema, puffiness, your higher blood pressure, shortness of breath because that fluid, might not be in just in your fingers and your toes, but it builds up around your heart and lungs too, which is something that we really don't want. And even if you aren't experiencing any of those symptoms, we still recommend that you limit the sodium in your diet. And we have to remember salt doesn't just come from the salt shaker. It is just loaded in so many of our processed and packaged foods, our fast foods that we as Americans, we just tend to eat a lot of those. And so even if you say, hey, I gave up my salt shaker, great job. It's a wonderful start, but there's more that you might should be doing probably. So what's the amount? 'Cause a lot of times they just hear, the doctor says, "Well, watch your salt." Okay, great, but give me a number, right? So highlighted in yellow here, aim for less than 2,000 milligrams of sodium per day. That's the general recommendation. And really, for those of us that don't have kidney disease or heart disease, this is an okay number. It's not that if we ate 2,000 milligrams, it's going to affect us in a negative way. That's plenty of sodium for any of us to be eating. Uh, and then we tell patients, how do you spread that out during the day? If you want to try, if you're someone that eats breakfast, lunch, supper, your 3 meals a day, just divide it by three and you can kind of get the 500 to 700 milligrams per meal. If you're a person that likes to have snacks, aim for the lower end and then you can have another couple 400 milligrams for your snack. An important thing is to learn how to read a food label. And I know I do have an example in some of the future slides here, but if that's something that you don't know how to do, that would be a good reason you should try and meet with a dietitian to really learn how to read a food label accurately, so then you can figure out what you can eat. And actually, I want to say before I go any further, there's really nothing you can't ever eat. I always like to tell patients there's no food I'll ever tell you don't ever have again. It all can fit in your diet. And even if it's a pretty salty one, well, hey, maybe we don't eat it very often or it's a treat. And as long as we add it up and it fits into like that 2,000 milligrams per day, you're going to be okay. Potassium. That might be a word that you've heard in the doctor's office or seen it on your labs. That is one of the lab values that we follow very closely on patients with kidney disease. And the reason for is potassium plays an important role in our nerve and muscle function, including our heart. Our heart is our most important muscle in our body. And as your GFR decreases or your functioning of your kidneys decreases, and your kidneys don't adequately filter it out, that potassium can build up in your body and it can actually be very dangerous. Now, today we're talking primarily on CKD stage 3. Very rarely have I ever seen someone with a high potassium or a really high potassium in this stage. But, progressing into stage 4 or 5, that's when we might see that and we have to start watching those foods a little bit more closely. And then what it can do is actually it can cause arrhythmias in your heart to where the heart could actually stop. So that's why it's something that we watch very, very closely. Research demonstrates that plant-based foods have less of an effect on our potassium level than plant and or animal and processed foods. So again, back to plant-based. If you were to Google renal diet or potassium foods, I can guarantee you the list of foods you see is going to be primarily fruits and vegetables, which they contain potassium, but so do all of your meats. And some of your meats contain just as much potassium as eating a banana. But for years, we've said don't eat bananas, don't eat oranges, don't eat potatoes. But recent studies have shown eating those foods, we actually it has less of an effect on our potassium level than maybe eating a piece of fish or chicken. But we've studied it, I guess, all wrong and given wrong information for the past many years, and so things have really, really changed. Not all patients need to restrict or limit your potassium, so that's very important. Another reason why it's important, I think, to meet with a dietitian if you can, so you can find out what your potassium level is and if you should be changing anything in your diet. We definitely do not recommend that you stop eating fruits and vegetables altogether. There's certainly that are some that are much higher than others, so maybe we would recommend that you limit some of those that are really high. But you definitely what all the benefits you get from fruits and vegetables far outweigh the potassium that you get from that might make your level go up a little bit. And then it's important to note that your dietary intake is not the only reason for a high potassium. Some other reasons here are chronic constipation, some medications, especially your blood pressure medications. Not all of them, but some of them can affect your potassium a little bit. And your doctor should be monitoring that, and sometimes they have to change your blood pressure medications if that might be the reason why your number goes up. And poorly managed diabetes. If your blood sugars are running high, quite high, your potassium could be running high too. So we have to look at all of those things. It's not just about the food. And I just like this little cartoon. And this dish is totally potassium free. And you see, there's telling you nothing. And sadly, I feel like that's what a lot of patients feel like when they learn they have kidney disease and they may read about the renal diet, and you feel like, oh, at the end of the day, what's left? I have nothing left to eat because everything has potassium and salt and phosphorus, et cetera, in it. And that's not what we want you to feel like. I really like this slide. This is a great representation that not all potassium foods are the same. If you remember, the slide before said that your plant-based foods, we don't absorb them as much, the potassium from those as much as we do from like the processed foods that have all of the potassium additives in them. I'm not sure why, it's just what our bodies do. So you can see while maybe, you can pick one of the foods from the left side that has, the processed potassium. It could be the same amount on paper as, maybe the banana or the orange on the other side, but our bodies don't absorb all of it from the banana and the orange. And so you can see it's very different. And again, for years we've been telling patients don't eat these foods, but they're so healthy for you with all the fiber and the vitamins and minerals, etc. And then of course all the processed foods have all the salt too. So another reason why we really want to get away from eating those or eating them minimally. I mean, there's burgers and fries and pizza on here, which I love just as much as the other person, but we just need to remember those should be treats for us. Okay, phosphorus. You probably have heard, or hope you've heard this word as well. This is another lab that your doctors monitor closely. So, phosphorus is a mineral that helps keep our bones healthy and our blood vessels and muscles working properly. Um, I remember when I started learning about this with kidneys, and I was like, wow, kidneys do a lot. They help keep our bones healthy too. Um, Again, at stage 3, very few people have a high phosphorus. It's usually in those later stages where we see it start to creep up and might have to be adjusting your diet. But what can happen is if your phosphorus level does go high, some immediate symptoms you might have might be some itching or joint pain, or nothing at all. Actually, I would say most patients don't even notice or feel anything that their number is high. But you can have us eventually you can have what's called calcification, which is where calcium comes out of your bones, which we don't want, makes your bones weak and brittle. But then the calcium gets deposited throughout your bodies and it cause calcifications in your blood vessels and such. And that's something we definitely don't want to happen. So that's why we monitor that very closely. Phosphorus, so where is that found? It's found in protein-rich foods, so all of your different types of meat, your beef, your chicken, pork, etc. Your whole grains, your dairy, beans, and lentils. Again, for years we have told patients don't eat whole grains. Eat all the white stuff. There's no fiber in there. There's no nothing in there, but eat white rice, white bread, white pasta. And we've changed our thinking on that as well. The foods, your processed foods will often have phosphorus additives in them, especially a lot of bottled beverages, flavored beverages. Some of your different sodas have them in there. Not all, which makes it very hard for patients to navigate the shelves at the grocery store to figure out where these are. But again, it's added to a lot of foods, and that is what um, can really drive someone's phosphorus number up and do some damage on their bones. The additives, they found that we've absorbed about 100% of however much phosphorus is in those, but probably only about 67, or even some of the foods I know it's a less percentage of that, or a lower percentage of the phosphorus in it. So again, the whole grains, the beans, the lentils that we for years told patients don't eat those, they have high phosphorus. You should eat them because you don't even absorb about half of what's in it, and you get a lot of good stuff, lots of other good stuff in there. Okay, so what about protein? Protein, protein's great. It's very wonderful. Definitely needed in the body. It's important for preventing malnutrition. builds our muscles. If you have surgery or have a wound, you need to heal, we need protein. However, too much protein can be harmful to your kidneys. Um, there is a component on your protein molecules, just the normal digestion, it gets filtered through our kidneys. So it makes sense that if we're trying to preserve your kidneys or make them work less and try to, not damage them or stress them out, we would eat less protein. Um, how much is that? That's a different number for all of you because your different body sizes, your different stages of kidney disease. At stage 3, again, the recommendation isn't too strict as far as how much to limit it to, but as someone progresses to stage 4 and stage 5, it gets more restrictive. Um, and then eating protein, if you are diabetic, we definitely want to make sure you do continue to eat protein throughout the day. The goal isn't to eat no protein. We don't want you to get that message, but it helps to stabilize your blood sugar. So we want that combination of just the right amount of protein with the carbs and fat at each meal. All right, so plant versus animal protein. We've been talking about plant-based protein or plant-based diet, excuse me. Um, and then we talk about protein. Most of us, we think animal products, chicken, beef, pork, etc. And we're in Wisconsin, so I think most of us are a pretty animal-centric culture here. A lot of my patients, anyway, where I live and work, are primarily farmers or retired farmers. So they've grown up on protein or grown up on beef and animal products. And so when you start talking about plant-based protein, they look at me a little weird. But plant-based protein, they have found that it's easier for our kidneys to filter. And so, like I said on the previous side, it's important that we get an adequate amount of protein to make sure we maintain our muscle mass or overall nutrition status. But it could be beneficial to start eating a little less animal protein and getting some more protein from plant products. The picture there in the blue actually shows the best to the worst proteins for kidney disease. And you see way on the left, it starts with soy products into plant proteins such as nuts and beans and seeds, those lentils, the dried beans that I was talking about with the phosphorus. They have a lot of protein too. Eggs, fish, poultry, and then your red meat. And I would like to clarify in that picture, the dairy should not really be right with the red meat. It's more down in the fish area. And the way they come up with this picture is again about how much acid load it gives our body. And so there is a measurement that they do. Each of these foods has a number, and so the dairy is actually a little bit lower, not quite so harsh on our kidneys. But red meat, I hate to break it to everyone, but red meat it's the toughest and worst for our kidneys. And it's very inflammatory. And actually I would say for any almost every medical condition, if you have heart disease or high cholesterol, red meat should be limited as well. Not cut out, but limited. So a lot of people, when I'm talking to them about this, they go, "Oh boy, do I have to become vegetarian?" Of course not. We're not, I mean, if you want to, great. If you want to, go full force and go in that direction, fabulous. More power to you. But you don't have to. I think every little step you do is progress and will help your kidneys. And they say just 1 or 2 vegetarian meals a week. Studies have shown that that can benefit your kidneys. And then just trying to do just 1 meatless day a week can be very beneficial. And so if you maybe after today, you can say, okay, talk with your spouse or your friends, family, and maybe like, I'm going to pick 1 day a week, and we're going to do meatless Monday. That's a kind of a pretty a famous this Meatless Monday campaign out there. I know that a lot of people have heard. So maybe that's what you would choose. All right, so vegetarian sources of protein. Again, a lot of people they're like, well, I don't even know what vegetarian sources of protein are. This is a nice picture list of some common ones. We talked about the nuts and the lentils, dried beans, the black beans there. There's some grains on here, believe it or not. Some of your grains actually have quite a bit of protein. That bowl of quinoa there for 1 cup, it has 8 grams of protein. That's like eating an egg. Hummus, if you don't know what hummus is, that's chickpeas ground up. I actually had some for lunch today. It's great. You can just dip it with vegetables, or you spread it on. Use it like a spread on your sandwich instead of like mayo or mustard. That could be adding some protein to your sandwich. Comes in a lot of different flavors. So if you haven't tried it, I would encourage you to try it. Peanut butter. So lots of different options out there that don't feel. I think a lot of us, myself included, for a long time, we felt like if I don't have meat on my plate at a meal, it's not a complete meal, but there are a lot of different options for protein that don't have to be meat. And I'm always a fan of pictures. I think pictures can speak 1,000 words there. This is what a good balanced meal should look like. You see, it doesn't, it's not void of meat. It has a small portion of meat there, some whole grains, and some vegetables. And just take a moment and look at that and kind of think to yourself, how does this compare to what I'm eating at home now? I can tell you when I see patients and we talk about, I always go through a diet recall and we talk about what do you usually do for breakfast, for lunch, for supper, etc. And they might tell me it's usually meat and some type of starch. And I'm like, okay, well, how about a fruit or vegetable? No, very rarely do patients have much of a vegetable. And if they do, it's probably not proportioned like this. It's probably a larger piece of meat, a much larger portion of the starch, and maybe a little dollop of vegetable in the corner of your plate. So, um, this is what maybe you can just look at this and take a photo of it in your head there, and this is what your plate should look like moving forward. All right. So to recap here, these are your general guidelines. Again, the first and foremost thing we recommend patients you should do at all stages um, is to have a low sodium, which means 2,000 milligrams or less per day. And again, this is great for everybody. So sometimes patients think, well, if you're, you have your whole family at home, your young kids, and you don't, you feel like you're going to be cooking a separate meal for them. Nope, this is okay for them to eat like this too. They don't need any all that processed extra sodium from packaged foods. They will be just fine eating this. Uh, Protein definitely should have lower protein. However, how much you have is very individual, and that's something I would again recommend you see a dietitian for so you can get those specific recommendations. Aim for more plant-based protein and maybe try one meatless day a week. Your phosphorus and potassium, we don't recommend any restrictions unless your labs indicate. So that means if you go to your doctor and you have your labs checked before that and your phosphorus is high or your potassium is high, then we would, sit down with you, figure out what you might be eating, and if there's something that you could benefit from cutting back on. Again, in stage 3, that's not too often, but sometimes. But if you could just get back to less processed stuff, more whole foods, fresh fruits and vegetables, whole grains, all of those should probably fit into your diet very nicely. And then fluid, I didn't really have a slide on that. Fluid, again, no restriction unless you're showing signs of fluid overload. Again, at stage 3, the doctors and dietitians, we usually don't give you a specific fluid restriction. That's usually in the much later stages, or maybe not even until a person is actually on dialysis that they would need that. All right, so when you kind of have all of your guidelines that you're going to try and follow, if you have a food label in front of you, I always tell patients this is your best tool, and this is where you can hopefully fit everything you want into your diet. Now, that might mean if it's something high in salt that is your favorite food, well, don't give it up, enjoy it, but you might have to eat less of it than you're used to for it to fit into, especially that sodium recommendation of 2000 milligrams or less. Um, I always tell patients, make sure you look at the portion size or what the serving size is. Excuse me. Um, and you see this particular example has 8 servings per container. So all these numbers in here, this isn't what's in the whole container. You have to, if you were to eat all of this, you would have to multiply it times 8. Um, so this is 2/3 of a cup. Let's pretend this is cereal. If you ate 2/3 of a cup, you're going to get 160 milligrams of sodium. That's not that much. Remember, if you divided 2000 by 3, we're going to go aim for 5 to 700 per meal. So 160, you still got quite a bit left for that meal. You're like, oh man, 2/3 of a cup, that's really not going to fill me up. Well, okay, so let's double it. If you double it, then you got to double the sodium number. And that's okay. If it still fits in there, no problem. And you might be wondering, well, here, this does have a potassium number down here. Phosphorus is never going to be on here. Hopefully someday, maybe in the future, but by law right now, it does not have to be on here. So if you feel like you're missing it, you're not. It's just not on there. But what we can do, if you remember, I was talking about those phosphorus additives that are so not good for us, that you will find in the ingredients list. And if you see highlighted in red here, if you can find any of these words that have phosphate, the PHOS in there in the ingredients list, that is a type of phosphorus additive. How much is in there? We don't know. But we just know it's in there and we know we absorb about 100% of it. So we don't want it, or we want as little as possible. So if you find it on a food that you're eating, maybe you can find a comparable product on the shelf that doesn't have it in there or has fewer additives in it, and that would be a better choice. I will tell you, it's very hard to eat a phosphorus additive-free diet, but just now that hopefully I'm giving you this information that you can go forth and do a little bit better than you were, because they're hidden in everything. It's really hard for patients to navigate those shelves and try to find them without. Uh, okay, so in lieu of the holiday season, I thought this was kind of cute. Your Santa hooked up to a dialysis machine, and the nurse is saying, "I don't care what day it is, 4 hours is 4 hours." So again, this is something where you are hoping to keep you away from that, no matter what your work schedule is, your life schedule, your family schedule. If you were to be on dialysis someday, the typical prescription is 3 days a week for 4 hours. And you really don't want to skip those or shorten them, no matter how busy you think you are, because um, that could be really detrimental to your life. So yeah, hopefully we can do a lot with your diet to prevent you from ever getting there. So what can you do? So like I said, this is a broad overview of eating plant-based and what can help you preserve your kidneys. But I would recommend, if you have not had your doctor, your nephrologist suggest that you see a dietitian, just ask, see if you can get a referral for one. Um, Specifically for a renal dietitian, because I mean, just like doctors specialize in their areas, so do dietitians. Your health organization may or may not have one that specializes in that, but just ask and see if you can get hooked up with one. If not, the National Kidney Foundation and the Academy of Nutrition and Dietetics both have links or websites that are web pages that have uh, contact information for people throughout the country that are renal dietitians. So maybe you could find someone that way. And it could be virtual. If you're okay with doing virtual, I know a lot of healthcare is going that way. If you can do a virtual appointment, so maybe it's not in your nearby town, but or in your health system, but you could see someone virtually. That would be just as good. And you might be wondering, well, what's the cost for coverage for seeing a dietitian? Because, that's always in the back of a person's mind when you're thinking about more appointments, more referrals, and I totally get it. If you are on Medicare, though, it's 100% covered. And a lot of people don't know that, and a lot of physicians don't know that if you're on Medicare, your first year of using that benefit, you get 3 hours of education or 3 hours of visits with a dietitian, and then 2 years thereafter. And then, of course, your commercial insurance, that varies. I certainly couldn't tell you. There's so many of them out there. I would just call your insurance to see what the coverage is, but they're often pretty similar to Medicare, or at least you get some partial coverage for most commercial insurances that I've worked with. All right, and this is just a list of patient resources, lots of them out there. I know, you start to Google things and it's an abyss of information and wondering what is true, what is not true, etc. And definitely if you just Google the renal diet, there can be so much conflicting information, and I would say a lot of just old information that's not necessarily correct. So if you kidney.org, that is the National Kidney Foundation website. There are a lot of information on there, including recipes, which a lot of people like. If you are more interested in reading an actual book, there's The Plant Fed Kidneys. That is by Jennifer Moore. She's a well-known renal dietitian throughout the country. You can get that right on Amazon. I think it's like $20, so it's not super expensive. Jen Hernandez, again, another very well-known renal dietitian. She has her own company called Plant Powered Kidneys. So plantpoweredkidneys.com, a lot of great resources on there, including, again, recipes. And then if you're on Facebook, go to Plant Powered Kidneys Facebook page, and then you can just join that. I actually follow it. I don't converse in it very often. Well, actually, not at all. I never really do. It's meant for you, more for patients and family who might type in a question of like, hey, I got stage 3 or is misdiagnosed. I'm scared. What do I do? Can I eat this? Can I eat that? And people talk back and forth. So these are patients that are living and breathing it. Probably know more about it than I do because you're all going through it. So I think it's a nice resource. Melanie Betts, that's another kidney dietitian, thekidneydietitian.org. Again, a wonderful website. There's actually 2 areas on there. One is for CKD and one is for kidney stones, if any of you have those. So a lot of good information on that. Nutritionfacts.org, Forks Over Knives. Both of those have a lot of nice recipes. And then if you're someone who likes to track your food, especially if you might be wanting to track sodium or protein, if you do see a dietitian and he or she gives you like a specific amount or number of grams to aim for in a day, the app chronometer.com, I think is very user friendly. It's free. There are some upgrades or different levels of it that you can pay for, but just the basic one is free and it's easy to use. You just type in what you eat for meals, and then it tracks it all for the day for you. And I just love this quote, let thy food be thy medicine and thy medicine be thy food. I think it's just important to remember that, food, while it tastes great, we eat it because it tastes great and fills our tummies, but it first and foremost is medicine to our body. And if we eat the right foods, it really can, I think, treat a lot of things in our body, specifically kidney disease.
Okay. Well, thank you so much for sharing your expertise with us, Jill. Very much appreciate it. Like I said, feel free to reach out to us at National Kidney Foundation of Wisconsin if we can be of any help. Otherwise, everybody take care and have a great night.
All right.
Thank you so
Thank
much.
you.